Good morning, everyone. It's early day in Belgium at this time of the day. um, Thank you for inviting me again to talk to the at this international conference. 2 years ago, I talked about new developments in forensic odontology and DVI, and today I want to tell you a little bit more about issues and challenges that occur in forensic odontology in DVI. Some of them I think we should be concerned about as forensic odontologists. Others, we have to find out how we can cope with them and how we can use them in our advantage. As said in the very nice introduction, I graduated from Leuven Catholic University in Leuven in Belgium, long time ago. University was founded in 1425, so very soon we will have big celebrations on a 600th anniversary of that university. For those who have never been there, if you have an opportunity to come to a forensic odontology meeting in Leuven, it's absolutely worth the travel. As far from myself, I am situated in the center of Belgium, just north of Brussels, in a little village of 𝐬𝐤𝐭, which you might know from the beer, but which is very famous because we have a very nice abbey there. Every Sunday morning you can go to 10 o'clock mass and enjoy the Gregorian choir that sings there. I used to be a general practitioner. I had my office there, but I am retired now. And as you can see on the top picture of the slide, I have become an ambassador. I have become a guide for our microbrewery in the Abbey. And again, I would kindly invite you to come and join me there, and I'll be happy to give you a tour and a tasting of 𝐬𝐤𝐭 beer. But that's not why we're here. What are the problems? What are the issues in forensic odontology, in forensic science in general? We are going into a globalizing world. There is an increase in travel. There is an increase in international organizations, people traveling back and forth. We are facing serious problems like international terrorism, which cause great damage to society. We are facing international armed conflicts. We are facing the problem of international migration. All these things are related to mass disaster, which I would call globalized mass disasters. Just think about in the recent years, the airplane crashes that we've seen. Long time ago, Lockerbie, Swissair, New York, Concorde, or more recent, the MH17, which was shot down over Ukraine by rebels. I was with the Belgian DVI team. I was participating in the identification of the victims of that MH17 disaster. We are facing terrorism attacks all over the world. 9/11, Bali, Madrid, London, Sharm el-Sheikh, IS attacks in Paris and in Brussels. And again, I was part of the Belgian DVI team that handled the identification of the victims in Brussels. With the global warming of the Earth, we are facing globalized mass disaster from where nature is the nature of the disaster. Just think of tsunami, just think of mudslides, earthquakes, hurricanes, the recent bushfires we've had, volcano eruptions. Again, all these can cause huge disasters where we as forensic scientists will be faced with different challenges, with different issues. We have at the moment ongoing international armed conflicts, Ukraine conflicts, lots of victims, the Syrian civil war. Here in Europe, in Western Europe, we're facing a problem of international migration. linked to human trafficking, linked to illegal migration, which cause a lot of victims and which give us a lot of problems in identifying the victims. Now, when we're talking about disaster victim identification, there is one thing we should never forget, and that is the base of my presentation. Actually, DVI, disaster victim identification, is still and will be and has to stay an interdisciplinary approach. This is essential. This is essential in a good handling, in a good in good workflow for disaster victim identification. DVI, it was mentioned in the introduction. I used to be the chief forensic scientific officer for the DVI Interpol group, which means that we have international standards. These international standards are very important because they will allow us to work according to the same protocols, to the same procedures, no matter where the disaster happens. And with this globalization, we will have victims from different countries involved in these disasters. So it is very important that the work that we deliver can withstand international legal scrutiny. It has to fit the international laws. That's mandatory. New technology and communication means is very important. We have to implement new technologies in our DVI work. We have to implement new communication means that are developed and that we are facing. It's going very fast, sometimes too fast, and yeah, implementing them means that there is progress. Why do we want that? Because standing still is regressing. If you're not going with the flow, if you're not going with the new things, you are regressing, and you will be past. As General Patton used to say, a good plan today is better than a perfect plan tomorrow. If you're not ready today, something will happen. You will have to start working tomorrow. You will be too late. So this is one of the reasons why Interpol DVI group, the standing committee as we call it, means on a yearly basis at the Interpol headquarters, 1 year in Lyon in France, 1 year in Singapore. And this is very important because this is where all the national DVI teams gather. There is about 200 people taking part in these annual meetings. What do we do there? We present operations that we had. We present them. What kind of disaster was it? What difficulties were we facing? How did we solve them? How did we tackle them? How did we handle that situation that we ran into? Did it give a good result? Yes, if so, we will introduce the solutions so that other teams can plan ahead for the future. This is very important. This planning ahead is important because it means a team building and a training. And this is one other very essential part of DVI work. I found this saying, and I found it to be very true, especially in DVI. And it's a sentence that we hear very often. We even hear it very often at these Interpol meetings. Yes, it works because, well, you know, we've always done it this way. Is that good practice? Maybe not. Just to give you an example, when I was there in the beginning, I've been taking part in these meetings since 1995. And at that moment, I was an activist for forensic odontology in DVI. It wasn't developed like it is now, and I gave them the example that dental data, dental antemortem data, had to be collected from the treating dentist, and that this had to be done by odontologists, because there is the medical secret. There is the international law on the medical secret that has to be respected. And the policeman said, oh, but we are doing it. We are always going to the dentist and we collect the data and we process them. And I said, well, this is not correct. This is not legal. You can't do that. It's a violation of the dental secret. And the answer I got from these people was, well, we've always done it this way and it has never been a problem. Does that justify it? Does that make it legal? No, it doesn't. So this sentence, we've always done it this way and it has created no problem so far, is not a good sentence. It's actually something that we should be worried about. If you change nothing, nothing will change. That's a given thing. The other problem that might arise is if you change nothing, things might just change naturally, but they might change in a way that you don't want them to change. If you implement changes, these changes have to be taught. They have to be discussed. I used to sit 2 years ago when I lectured for the other conference at your organization. I talked about the 6 Sigma test before you implement something, and that's something that we should continue doing. Test it, try it, control it, and then see if it works. If it doesn't, let's change it. New changes will not always be immediately okay, but that's, for example, why at Interpol group, the standing committee, we have this subgroup forensic odontology, and we have a separate meeting. We have a separate meeting because there we can discuss our specific issues, our specific challenges in forensic odontology. We discuss them between the forensic odontologists because they're the specialists. And then we take them to the general meeting, to the general standing committee, and we introduce them and we put them on the table and ask them to be agreed on. What are issues and challenges that we are facing in forensic odontology? Standards are necessary. I was talking about standards, I was talking about protocols. They are necessary. But who is qualified for setting the standards, and which standards are we going to set? Which standards are we going to impose? Is not maybe a bad word, but all the standards, all the protocols, you can find them in the Interpol guide, which is on the internet. Which is the big challenge then, is that we all have to come to terms about these different issues, so that the final DVI result, as I said, will be able to withstand international legal scrutiny. If a disaster would happen in India, let's say a plane crashes in India with different nationalities on board, different victims from different nationalities, maybe foreign DVI teams will come into your country, but they will have to respect the Indian laws. The Indian law on identification will prevail over all other laws. So this is important to realize. When we do a disaster victim identification, we will have to work accordingly to the international legal laws. I said it is forensic odontology is part of a DVI team. We're a member of that this interdisciplinary team of experts. We're not working alone. We're working in group. Very important. We're working together with policemen, and they will do their part of the work. They will do their part. It's described in the Interpol guide. We will work together with forensic pathologists and anthropologists. We will work together with DNA specialists. So we just every one of these experts, of these different experts group, they will do their own work in their own field. And at the end of the day, so to say, we sit together, we bring all our observations together, and we will put them together and see if this can lead us to an identification. And in that respect, I would say by working as a interdisciplinary team, I would say 1 + 1 makes 3, and will eventually lead us to identification. Now, in this Interpol guide, it is said that there are 3 primary identification methods. And I always, when I lecture, I always start, of course, with dental odontology. Odontology is one of the primary identification methods. So for a good understanding, it doesn't mean that these primary identification methods are the ones that we have to start with. Odontology, DNA, fingerprint, radiology. No, what it means is that these 3 methods can solely produce a 100% scientific certainty about identification. And we will just gradually use them. We will use them as we use the secondary identification methods, which we describe as circumstantial evidence. They will just add to the process of identification. But these are important, and these 3 methods should be tried anyway, regardless of all other aspects of an identification procedure. Now, to do that, I was talking about standards. Which standards should we try to set? We should try to set standards on procedures. How are we going to work? Who is doing what? It's the logistic thing. Accreditation, I will come back to that at the end, as I will on the experts. Who can take part? Who is a forensic specialist? Who is an expert? Are there any criteria? Are there any standards that a person has to fulfill to be considered or to be appointed as an expert? The same with DVI teams. We saw at Tsunami, there were about 37 countries taking part in the identification of those victims. And what we experienced, what we noticed that there was a big difference in expertise level from those different DVI teams, which is a risk. What we want is everyone taking part in an identification procedure to work in the same way, according to the same protocols. This is why when we have a big DVI operation, every day there is a debriefing meeting with the staff. And the staff will face challenges, will face issues that we ran into and that people report on. And they will try to find a solution to that. So what we do at that time is just modify our protocols. These protocols, these procedures, they are a very flexible thing. Very important is that everybody follows these protocols. At the end, we want to come to to conclusions that are based on the same way, on the same findings. That's the working methods. They have to be discussed the whole time. Same with the forms. In a mass disaster, we will use the Interpol DVI forms. The yellow ones for AM, the pink ones for PM. Where do we have standards as odontologists? What should we have standards on? Well, first of all, the antemortem data. This is important. How will we gather it? What's the availability, the transmission, the transcription, and the quality? Antemortem is the most difficult part in a DVI operation. The postmortems, yes, we write standards how to work about gathering in the mortuary, how to gather the postmortem data, how to process the bodies, and how to do a comparison. What is necessary when we compare antemortem and postmortem records to come to a conclusion of a positive identity? Which degrees of identity do we have? How do we process? How do we put that in a report? That's all the standards on odontology in DVI that we need to take into consideration. I wrote a very nice article on how to, on the protocols for collecting dental antemortem data, and I invite you to read it. This is the summary. As I explained about that, we've always done it that way. No, that's not how it works. Finding the victim dentist through the family, that can be done by the police, by social services. That is no problem. Once we've crossed that line, we have to take contact with the victim's dentist. My experience in all the disasters I was involved in is that this is best done by an odontologist. Why? It makes it easier to talk from peer to peer. Some dentists, some odontologists will not reveal certain information to a non-dentist. Also, the medical secret plays there. The collection, the practical collection of the antemortem data can easily be done by the police. After the peers have talked to each other, the forensic odontologist on the DVI side can say, okay, put all the information, put the dental records, put the x-rays, put all you have in a sealed envelope to the attention of the forensic odontologist in the DVI team, and the policeman will come pick it up. That's no problem. In acting that way, we do respect the medical secret. Once the antemortem record comes in, we have to check it. Is it okay? Is it valuable? What is the quality? Consider it kind of a quality check. Once we've done that part, the quality check, we have to make the transcription. We have to make the transcription from the antemortem dental data from the dental office to the 600, 700 forms of the Interpol forms. And very important, and you learn a lesson every time you're involved in a disaster, because no disasters are alike. We have to keep a good log of the incoming dental data. When I was working, one of the last disasters I was working on was the Brussels terrorist attacks. And we were a bit short of odontologists on the DVI team because of budgets from the government. So we did not have someone keeping logs on the incoming antemortem dental data. And I can tell you, this caused us a lot of problems. And it was an issue that I brought to the attention of the authorities, saying, listen, we need this. This is very important, because at any point in the identification procedure, you have to be able to know where information is coming from, who delivered it, who received it, what did we get, so that there is always this possibility to go back if you need more antemortem information. Some other dental challenges, and those having been involved in forensic odontology in DVI know this. There's a big lack of, on the international level, on dental record keeping. There are different reasons for that. The first one being the legal obligation of record keeping. I don't know the specific situation in India, but in Belgium, we have kind of a law on record keeping, which says that every dentist should keep a dental record to guarantee quality care on the patient. Now, my question when they wrote this law was, what is a dental record? What should be in it? Please specify for me which specific things have to be in the dental record. What is quality care? I'm sure that if I would ask all these people to this conference, okay, write down for me what is quality care for your patient, that I would get very different answers. So this is a problem. Again, standardizing the law on record keeping. Which of course brings us to the quality of the record. Some people would answer me, yes, I have good records. There already the word good records, quality of the records is an issue. So again, standardized way, and that's, in my opinion, there is a very important role for national dental societies who could try to impose it. Of course, it will have to go through the government. International Dental Society, the FDI, could play an important role there. Forensic Odontology Societies, IOFOS. And I know that at IOFOS we are working on that. We are working to give examples. We discuss that, what should be in it. And then from there, we have to try to impose it. We have to try to bring it to the attention of our authorities. The Ministry of Health will, in Belgium at least, the Ministry of Health, the Ministry of Justice will be the ones who will have to make these decisions. Having a law is one thing. Respecting the law is another thing. In the 90s, there was a review from Helena Borman in Sweden. They have had a national law on dental record keeping for the longest time. She did an investigation and she found out that despite the fact that there was this law, there was a good description of what had to be in the dental record, still about 60% of the dental records did not fulfill the requirements, the legal needs of the government. So having a law is one thing, acting according to the law is another thing. But there again, that's a role for national dental societies. That's a role for us forensic odontologists to bring that to the attention of the treating dentists, how important it can be. And as very often I get the answer then, oh, but yes, you know, how many times will we need dental records of my patients to do an identification? Yes, that is a point. They have a point by saying that, but one time's enough. You don't want that victim not being identified because you don't have a good dental record on them. You don't want that to happen. You don't want to face the family having to say, well, I'm sorry, if I would have had a good dental record, your relative would have been identified by now. But also, and odontologists are more attentive to that. Keeping good dental records is risk management for themselves. It is the best way to withstand claims from patients about maltreatment, for example. That is an argument that most dentists will have more attention to than the fact of identification. Other dental challenges in the AM, it's the international standards on transcription of dental records. I've seen many in the different disasters that I was involved in. And well, first of all, there is the language. It is a problem, or it might be a problem if I get a dental record from India. Well, I might not be able to read it because of the language, because of abbreviations that have been used. And I'm using the example of India, but for example, two of our neighboring countries, France and the Netherlands, when I get records from there, I can't read them because it's all with numbers and codes. So I have to have this code to be able to make a good transcription of the records onto the 600 and 700 Interpol forms. When we put this information from the original dental record onto the 600 and 700 forms, we will use certain abbreviations. Well, it is very important that these abbreviations have been agreed upon internationally, worldwide. And this is what the DVI Forensic Odontology Working Group that I was mentioning is working about. When the software program from Plus Data was introduced, it had about 130 abbreviations only on dental. That was not workable. So gradually, we worked through these at this forensic odontology working group, and we reduced it for a big amount, so that now we have a list of abbreviations that have to be used by everyone, but which is workable. Yeah. Threats on forensic odontology in DVI. I told you I have some concerns. With these natural disasters, and just a few examples, Hawaii wildfire just a couple of weeks ago, every year coming back, the Australian bushfires, we have these huge floodings in different places in the world. Recently, we had a Turkish earthquake. We have the problem of illegal immigration, especially on the southern European shores, mostly in Italy. Human trafficking. People are coming from all over Africa, from all over Asia, trying to get into the European Union. These people, or in these situations, we might not have antemortem dental records. Now, if we don't have antemortem dental records, we are not able to compare. So we have to cope with that, and we have to find other ways. Now, the fact that we don't have antemortem dental records there doesn't mean, as I said in the beginning, it's an interdisciplinary approach. We should not step off the normal procedures of interdisciplinary approach. In my opinion, a big danger comes from DNA, and danger is maybe a bad word, but a big threat comes from DNA. Very often I read, well, we will just do DNA and we will forget about the other primary identifiers. This is not correct. Even though the DNA is very important in DVI, now DNA is used in age estimation. Well, we all know that dental age estimation is very important, is very accurate. DNA now comes up with these investigations where they do an age estimation and where they say, well, we don't need dental age estimation anymore. That's a threat for forensic odontology. There are new developments. Again, I was reading when preparing this presentation, I was reading through a couple of articles on the internet in the Russian-Ukraine war. I read about facial recognition of the victims of that conflict, and where bodies were found in mass graves, and this commercial company was just doing facial recognition. Is becoming very important and is being introduced on the field of disaster victim identification. And I will come back to that by the end of my presentation. In these cases, we don't have antemortem records. There might be different reasons for that. I can imagine that with the bushfires, with the wildfires, with the floodings, dental offices might have been destroyed as well, and so there is not, or there are chances that the antemortem dental information will have been lost. We've had it 2 years ago when we had a big flooding in Belgium with about 32 victims. Belgium was okay. In Germany, they had a couple of hundred of victims, but they were facing the same problems. Information was washed away. Turkish earthquake. When we find these refugees, these people from illegal immigration, these people from human trafficking, we don't know where they come from. So where to get the antemortem dental information? We can't have that. Here you see a couple of examples in which the chances are big that antemortem information is lost. On the left, on the top, the floodings. On the right, the earthquakes. And at the bottom, the situation in Hawaii or in Australia. And our Australian colleagues have reported or do report at the Interpol meetings almost every year about the problems they have or they are facing when having these bushfires and when finding the victims of those fires. And there were the same problems in Hawaii. Here, you can imagine the little boats with illegal immigrants coming from Africa trying to join Europe, and the result on the bottom slide, we find those bodies that come ashore. The ship capsizes, and many people lose their lives. In Italy, where they are faced with it, they call the Mediterranean the biggest graveyard in the world. Thousands and thousands of people are still at the bottom of the Mediterranean. And some of my colleagues, Danilo De Angelis, Cristina Cataneo, did do or wrote an article about the challenges in the identification of dead migrants in the Mediterranean. There was this big Lampedusa shipwreck. 60% of the victims that came ashore were buried unidentified. There were many reasons for that. One being the lack of strategies over antemortem and postmortem collection. Of course, if you want to have antemortem collection, you have to be able to have an idea of who the victim is and go to the families, find the families, which in these cases, these people come from all over Africa, come from all over Asia, which is not easy. Mostly they don't have much goods with them. DNA analysis may at times present difficulties, even though it is proclaimed as being the Holy Grail, and with DNA we can solve these problems. But still, the problem stays the same. With DNA identification, even though it's a primary identifier, you still have to compare antemortem with postmortem data. Yes, it might give you a clue in interfamiliar connections. But all these problems, these Italian people, they're from the University of Milan, are very much involved. Their conclusion was that new strategies for positive identification have to be defined in each field, also in odontology. So that means that we have to face the challenge, we have to face that issue, and we have to be very creative to try to find a solution and come up with something. Ukraine war, I was reading through it, same problem, lots of mass graves. There must be about 100,000 victims. Problem is, they're Ukraine military, they're Russian military, they're civilians. Who is who, what is what? We all know to mislead for identification, all different kinds of actions will be taken to mislead the experts, to mislead the scientists. So again, what are the problems there? High amount of victims, mass graves, lack of trained personnel, lack of material, lack of facilities, lack of resources. A couple of months ago, with ETAF, the German NGO that I'm a member of the board of, we organized a meeting with experts from Ukraine, and we were discussing, it was a 1-week meeting, and we discussed all of the problems. And it came out from them that, first of all, they had no material, they had no facilities. A lot of the facilities are destroyed. They had no resources. The people need to be trained, need to be better trained. So these trainings, we have to give these training programs by foreign nations. In my research, I read that a number of Ukrainian experts were trained by Japan to do DNA. Again, DNA, and we forget about the rest. People get help there from the International Committee of the Red Cross, of the International Committee of Missing Persons, of NGOs. But there is a long way. There is a long way to go, and especially in odontology, we have some issues there. Same issues they were facing in Hawaii. Again, I was reading through it, and what immediately struck my mind was that I was reading DNA will probably be the only way to identify the victims. And I thought, no, this is not correct. We still, despite the situation, we still have to do this interdisciplinary approach. We still have to go through all the phases. And then you read these articles in the newspapers that Hawaiian officials were urging the families to submit DNA to help identify fire victims. Yeah, okay, it's a way, but still there are other means. And then you read the advent of DNA technology and subsequent advances have provided powerful tools. I think that odontology is a very powerful tool as well, and has to be used, or we have to try to use it in any way. And yes, I do agree that in these situations, dental and medical records might be unavailable or difficult to track down. Although my wife told me last night, she said, "Well, my dental records from my office, they're all they're all in the cloud there. So even if our office would be destroyed, it would still be possible to retrieve them." And that's something that we have to keep in mind very well. My good friend 𝐬𝐤𝐭, and you know him very well in India, he has founded this Association of Forensic Odontology and Human Respect, and he says that we have to apply the highest identification standards and Interpol guidelines to all the unidentified human remains. And I think that is a good start. That's a good principle. That's a good philosophy. All of the victims, regardless of the kind of disaster they are involved in, they deserve the highest identification standards. And the best way to get them that highest identification standard is to follow the Interpol guidelines and work accordingly to the Interpol guidelines and to the protocols that are described. With this lack of ante-mortem availability of dental data, after the flooding in Belgium, I made a plea in the media. Why don't we create a central dental database with access for forensic odontologists, so that in case of disasters where offices are destroyed, we could go to this central database and collect the ante-mortem data that we need from there. In this specific case, the flooding happened on a Thursday, so by the time we could contact some authorities to get information, it was Friday afternoon, and nobody still works on the Friday afternoon. So they told us, "Yeah, we will contact you on Monday." And then on Monday they recontacted us. "What do you need? We need this." So the flooding happened on the Thursday, and my first ante-mortem information came in on the next Tuesday or Wednesday. That's 5-6 days lost for the families. The families want to have their relative identified as quick as possible. This is something that could be solved by creating this central database. Also, the accessibility would be much easier. And again, I read that in Japan, after the Fukushima disaster, in the aftermath of that, they started creating this central database so that information could be found easily. This is very important when you have a big amount of victims, because it is a good way and an easy way and a speedy way of collecting ante-mortem information. You might get the impression that I'm not very keen on DNA. That's not the issue. The issue is that odontology should be put aside in favor of DNA. DNA is very important, and teeth play a very important role in DNA, as we can extract a lot of DNA from teeth. Here's some of the examples where the DNA information can come from: blood, saliva, semen, hair follicles, bone, tooth. Mostly what is done, it's taken from femur. We take a femur sample of victims. They forget that if you take them from teeth, you get very valuable information as well. Here, a little example of all the oral sources for DNA analysis. And on the left side, you see the teeth, and then you have the different techniques. And we have cellular material, biological material in the pulp, in the dentine, in the cementum. So that is very useful. They're using it in DNA in biometric age estimation. And you see there, we all know that we can do age estimation from teeth. We can also do it from other sources, and DNA with the methylation techniques are definitely something that will become very important in the future. An interesting article about that, a very recent article from November 22 that I found on dental DNA in age estimation based on methylation using the real-time methylation specific polychain reaction. Interesting to read, and definitely something to keep in mind and to keep an eye on for the future. Now, I was telling that we are using mostly femur. These results or these conclusions came from an operation that we were doing where we were trying to identify people, victims, unidentified victims from a mine disaster from 1956. So that is about 65 years ago. We did the multidisciplinary, we applied the Interpol DVI protocols on all of these victims, and our DNA specialist found out that DNA from teeth, or that actually that teeth samples give 3 times more DNA than femurs. That these victims had been buried for over 60 years. He found out that teeth DNA was less degraded. So I would say that this is a very strong argument to use teeth as a source for DNA analysis. Artificial intelligence is something which is coming on very quickly, which gives us a lot of possibilities. What is it? It's making computers sophisticated enough to imitate, even outperform our thoughts, our conclusions. What are the advantages? It allows us to have a more effective data administration. It can improve identification, or it will improve identification, because it's very objective. It's consistent. It is possible to make a pattern recognition, which is important in age estimation, age and sex estimation, and it can handle large data sets. Computers can do that much more efficiently, much more quicker than humans would do it. I was promoter of a PhD thesis, and the young lady did her thesis on the artificial intelligence and forensic odontology. She looked at she found 605 articles. Only 28 met the inclusion criteria. She found out that these were published between 2010 and 2022. And that 22 of the 28 were published in the last 2 years. So you can say that since 2020, artificial intelligence-based technology for forensic odontology are taking off in the last couple of years. What are the areas of focus for AI in forensic odontology? Dental comparison, age estimation, sex determination, and yes, human bite marks. The question was, one of the questions in her thesis was that would artificial intelligence be able to make human bite mark analysis a science again? And that's a very nice thing to look out for. Out of all the studies that she looked at, 47% concentrated on dental age estimation, 38% on sex determination, and only 7% were using or were used in human bite mark analysis. Artificial intelligence can give us a diagnosis. You have a panoramic X-ray, and it will give you a diagnosis. It can produce an antemortem, a postmortem record automatically. It can compare this antemortem, postmortem. It can do age estimation, and it can do anatomical tooth recognition. And here's some examples how it works. You go into these zones, you define these zones, and your artificial intelligence program will compare this for you and will come up with conclusions. A big challenge there is if the computer can do that, will we as forensic odontologists still be necessary? Will there still be work for us? Yeah, probably not all is really, how should I say, there are some doubts still about how correct it is, and in my opinion, even after a artificial intelligence program comes up with an identification, it will still have to be checked by human. Which brings us to my last points. Who is a forensic odontologist? Who is recognized as a forensic odontologist? When we're talking about DVI, we need odontologists, we need forensic odontologists. Who do we use? What is needed? Well, we need dentists with forensic odontology education. We need people that have been trained in mass disasters. They have to be familiar with DVI procedures, with DVI philosophy, with the use of the DVI forms. So that means that they have to be familiar with the protocols for odontologists in DVI. Because they have to be able to do this quality control at all levels, at level of AM, at level of PM, at level of the reconciliation, at level of the identification. And here's some, I did some research in a couple of countries. Australia has a pretty good description of what odontologists need to become or to be recognized or to get registered as a forensic odontologist. You have to have a degree in dentistry and a fellowship in forensic odontology from such and such an institution. Same in the USA. These accreditations, these training programs may come from universities, they may come from forensic societies, like in the US, the American Society of Forensic Odontology. But the base of all is you have to be a dentist, you have to have specific training. So that leads us, where do we go from here? We have all these new things. We have the past, we've always done it that way and it worked. We are trying to introduce new things in the present. And the question is, where will that take us in the future? Something to be followed, food for thought. And thank you very much for being with me this morning and listening to my presentation.